Good afternoon. We're here with Dr. Larry Klein of St. Petersburg, Florida, and his dentistry practice here. Dr. Klein, thank you very much for being with us. Tell us a little something about dental or gum care and gum disease and things that are really, really important as to how it affects our overall oral health care.
Well, gum disease is very, very important because it basically leads to systemic problems also in the rest of our body. I make the analogy about periodontal disease. Some people call it pyorrhea, gum disease, periodontal disease, whatever you want to call it. I just make the analogy that your teeth are like a tree. And you got the top part above the grass, you got the roots going down in the earth, you got the grass covering up the earth. Teeth are the same way, top part above the gums, roots down underneath the grass, and then you got the grass covering up the earth. So if you picture a bunch of gophers around the tree that are above the grass, no big deal, they're there. Just take a hose and squirt them away, okay? But if they get up underneath the grass, they're protected, they're hard to get off, they end up destroying the earth away from the roots of the tree. If you lose enough support around the roots of the tree, what happens? The tree falls down. Well, you can see what happens. Basically the same thing in your mouth. The plaque and the tartar are the gophers. They get up underneath the gums. They destroy the bone around the roots of the teeth. And even though you don't see that from the outside or from just looking at it, that bone deteriorates, then just like that tree, there's no support, teeth fall down. That's how people lose their teeth due to gum disease or periodontal disease. Like I said, pyorrhea, whatever you want to call it by different names.
Dr. Klein, once that occurs, can it be built up again if you have a deterioration of the bone underneath the gums? What can be done, and can you put implants in that will, and is there a certain age at which it doesn't make sense to do it anymore?
Great questions. I guess I'm going to address that in two parts. First part is obviously to catch things early. In the olden days, they didn't even worry about that. You had a tooth that all of a sudden is wiggly, they just took it out. Now what we do is we actually look for gum disease or periodontal disease ahead of time by measuring how much grass is around the tooth, or gum is around the tooth. And if that's caught it in an early enough time, we preserve the bone, clean things up, move it back to health. In the event that there is a lot of bone loss and the tooth has actually become mobile, certain types of grafting techniques and type of materials that can be used to help solidify that, but there are times where the tooth no longer can be saved. And at that point, then you get into implants and things that you need, that you can do that are options, or ways to basically restore that lost root of tooth. And from that we can go ahead and build teeth, we can build partials, we can build things upon that.
Now, teeth grinding. Teeth grinding is another, I guess, big problem where bite plates are becoming more common now amongst people so that they don't grind their teeth, but that also then affects and translates into deterioration of gums too. Is that right?
Exactly. Grinding your teeth, and picture it once again, I'm big into analogies. I mean, somebody called me Dr. Metaphor once, but if you had a pole that was cemented into the ground and you just kept on rocking that pole back and forth, sure enough, even though you have good cement there, you can rock that out. And once again, even worse, if you don't have good support up underneath there, you've got gum disease, you've already lost bone there, and you start grinding and really pushing those teeth back and forth, you will rock them right out.
Interesting. Well, Dr. Klein, thank you very much.